Hello, everybody, and welcome to ICMDA webinars. I'm Dr. Peter Saunders, the Chief Executive of the International Christian Medical and Dental Association. And in today's webinar, we'll be looking at the subject of how AI will change your life as a doctor with Dr. Patrick Dixon. So, I can think of no one better to talk about this subject than Dr. Patrick Dixon, how AI will change your life as a doctor. Many millions of lives will be saved each year by 2030. We're going to hear, as a direct result of AI, 400,000 in the EU alone. And at the same time, AI will remain invisible to sick patients receiving care in hospital or at home. Over $30 billion a year is already being spent on AI in healthcare, with budgets increasing by 30% or more every 12 months. And already 95% of healthcare companies are using AI, spending an average of 10% of their turnover on AI innovation, double what it was the year before. Is AI all good news in healthcare? Well, that's what we're going to hear. Or are there particular areas of concern for care workers of faith? Dr. Patrick Dixon will be no stranger to most of you. He's an MBE. He's the chairman of Global Change Limited. He's a qualified doctor as well, of course. He is an author of 18 books on global trends, including Life with AI, How to Survive and Succeed in a Super Smart World, and the Future of Almost Everything. Patrick's been ranked as one of the 20 most influential business thinkers alive today in the Thinkers 50. And he has spoken to audiences in over 60 countries, and is one of the world's most sought after keynote speakers at corporate events. Patrick, it's just a pleasure to have you back here. We really look forward to what you have to say and engaging with you afterwards. Over to you. Thanks.
Thank you, Peter. A great pleasure to be with you today, and welcome to you all in whatever part of the world you are, whether it's in China, Russia, Tajikistan, Uzbekistan, Peru, wherever you are, welcome. And I want to encourage you, I hope, in your own journey in inquiring as a Christian physician or nurse or healthcare worker to engaging with complex issues such as AI. So what does this mean? I'm going to take us on a bit of a journey, and I'm keen that it is also a discussion that you have the opportunity to talk. And so I'm not going to push off at the end, as I would if I was at a seminar for CMF in London. I will hang around, for a cup of coffee with anyone who'd like to chat. So I look forward to doing that in about an hour's time. So I'm going to look at the impact of AI on health and what that really means for you. So, yes, I work with not just health companies, but just about every kind of company, from Google to Microsoft to General Electric or Airbus, or every industry you can imagine in just about every part of the world. And the first thing I'd say to you is, when you think about AI, it's easy to get lost in a whole load of media hype. And it's been interesting to research this book and put it together, and to go on a journey myself and to discover that quite a lot of it really is hype. So let's tease out what's actually going on. As Peter has suggested just now, 95% of health companies are using AI already. It's growing very fast. And I have no doubt that AI will be saving 10 million lives a year within 20 years. Why is that? Now, before we answer that question, I just want us to understand the sheer size of what we're talking about. At present, this call and all the rest of digital, including powering mobile phones and things like that, we are burning up 4% of all global power on digital. But AI alone is likely to double that in the next 15 years. How is that possible? It's such a huge power consumption that Microsoft is busy reactivating the 3 Mile power station in the US. So it has nuclear power to try and power up some of its own AI needs. Sure. One thing's clear to me is that by 2060, whatever we have today will be 1 billion times smarter than now. But even now, it's getting spookily clever. There's a particular voice engine attached to ChatGPT, which I've been playing around with recently. Utterly fascinating. It's quite conversational. I tried it out with my grandchildren, and it sounds just like a human being. It sort of pauses and reflects, and you can almost hear the person scratching their head and thinking about another question to ask. It's deeply empathetic. It's insightful, um, and sensitive in its conversations. Extraordinary. And this is only today. What next? I'd like to look at the human brain for a moment because I find this is a fascinating area and helps us to understand AI. A few years ago, in fact, in 2013, Duke University started connecting the brains of mice together over 3,000 miles. So they put chips in a mouse brain and chips in another mouse brain and put them together wirelessly to solve puzzles. The mice don't really understand there's another mouse anywhere, but they kind of, we don't know how it works. We don't know how they're doing it, but they are learning to detect signals from the other mouse's brain. And together they're able to solve puzzles. And so long as they work together, they both get food. If they don't work together, they don't get as much food. And they're working together really, really well. So what about medicine? As at least 500,000 or 600,000 people in the world who already have similar chips inside their brains. In fact, most commonly for deafness. It's because they've completely lost the ability to hear, but they have an auditory nerve. And so the chip, the cochlear implant, this chip inside their head, has restored their hearing. And it's a dramatic thing. But I'm talking about something different now, which is the people who have had those chips inserted because they're paralyzed. And there's about between 50,000 and 100,000 human beings who already communicate using chips inside their brains. Nothing new about that. What is new is what happened to Noland here. He is a patient with Elon Musk's company, Neuralink, and very sadly is completely paralyzed from the neck down. And he was controlling his world just by sucking through a straw. 4 sucks and a long suck for the letter A, 3 sucks and 2 long sucks for the letter B. Oh, excruciating, terrible. And they put a special chip inside his brain, and they did something different with this one. They connected it to AI. Now, remember the thing about AI, it's just intelligence. You don't program it, you just let it think. And no one's really quite sure how AI is doing this, but let me just tell you what happened. When he woke up, he was asked if he felt any different, and the answer is no, not really. Yeah. And then he was put in front of the computer and asked to stare at it. And he said, "Whoa, that's freaky, man. As I'm thinking, the cursor's moving. I can't believe that." He said, "Oh, it's," and I'm clicking. Hey, that was a click. Just by thinking, he's moving the cursor. Just by thinking, he's selecting things. Just by thinking, he's making things happen. So the researchers were delighted, and they soon put him on a computer console called Mario Kart. I don't know if you've ever played that particular game, but it's a bit wild and involves high-speed use of a steering device to get your car around a track. You know what? Within 2 or 3 hours, he was beating most people in the lab playing Mario Kart. Okay, this is today. What about tomorrow, folks? 5% of 18 to 29-year-olds in the US who are perfectly healthy would say that they would definitely consider a chip like that. They think it would be cool to go online, to be part of AI, to have an AI-enhanced consciousness. Others at the conferences I speak at are rather worried about their own thoughts leaking online, about AI interrogating their brain, about being controlled in some subtle way. I'm just saying we're on the edge of something really quite extraordinary, not just to do with health. Okay, so what about health? Now, here's the bad news. The global pipeline of new drugs is really very small, and it's a slow process to get new drugs to market. We need radically new ways to do it. I qualified a huge length of time ago, maybe, I don't know, nearly 40 years ago. But I can tell you that many of the drugs today I recognize they're the same as drugs used 40 years ago. In a sense, a lot of medicine has stood still. And even when you develop a new drug, many of them get recalled. We've seen over 1,000 drug recalls every year, linked to adverse events, side effects. And in the US alone, 22 million of them have been reported since 2012. And then we get issues like antibiotic resistance. And as we've seen, terrible, terrible problems with a lack of antivirals. The last new class of antibiotics came to market in 1987. No wonder we have resistance as a problem. And we still don't have a single antiviral today which is as effective as penicillin was against bacteria in 1941. So it's shocking, really, about this lack of innovation, and AI will change that, and we need it. When we look at AI in health, it's already being used, it's become mainstream in ordinary hospital care in many countries, like the UK. Many patients already last year knew more about their condition than their doctors just using Google. 1.3 billion people wear all kinds of health devices, mobile phones, Fitbits, and so on. And in future, a lot of that data will be linked to AI. Now, here's another example of AI where we don't know how it works, but it's great. So AI has been trained on 18,000 recordings of patients, of which 9,000 had diabetes and 9,000 did not. As a result, if you phone the AI, or AI is allowed to listen to your voice, they can tell, the AI can tell in 10 seconds if you have type 2 diabetes. 85% accurate, so long as they also know your age, sex, height, and weight. That's super cool, amazing. And AI is already predicting thousands of conditions. At the same time, we've seen a massive fall in cost of studying each human genome, which means that the cost today has come down from around $1 billion per genome to less than 600. It will be less than $60, I think, in the next 15 years. Now, you don't need to look at all the genome to make a lot of difference. After all, 50% of your genes work in a banana, and a banana's genes, 50% of those work in you. I could put 50% of a banana in you and you wouldn't tell the difference. 70% of your genes are the same as an earthworm, and 97% the same as an orangutan monkey. So AI only has to look at a tiny part. And we already have 500,000 human genomes to start with to feed into AI, which we can link to health records, lifestyle data, and so on. And we are already mapping this to 1 million genetic mutations. We're in the first hour of the first day. What about tomorrow? You can see that just linking AI to the Human Genome Project could have a massive transforming impact for the future. But, I was speaking at a conference of 1,000 doctors and research scientists only last week in London. And I asked them, would you like AI to tell you your future? Would you like AI to predict whether you will develop Alzheimer's by your 60th birthday? And around a third of the researchers there said, yes, 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 I would really like to know. A third said, no, no, no. If you can't treat it, don't burden me with a diagnosis. I don't want this information. And another third couldn't make up their minds. So AI strikes all kinds of important issues which connect with human emotion. It's not just about technology. It's profound ethical, psychological, even spiritual questions being posed. Now, AI is much more accurate than most clinicians in interpreting these kinds of scans. 1 in 3 US hospitals already use AI in diagnosis. AI can read hundreds of chest x-rays in 3 minutes and do it more accurately than any human being. AI only misses 1 in 200 cancer cells. Human beings miss 1 in 30. AI is more accurate than any lab in diagnosing cancer of the bowel. It's superb at diagnosing instantly from just an iPhone photo if you have skin cancer. We are seeing already 750,000 AI-assisted operations in the US every year. AI is already being used to decide who gets what organs, predicting outcomes from transplant. AI is predicting risk of infection and predicting the next action. This is an interesting video. I hope you can see it. And there are parts of the video which are colored because the surgeon is being told by AI in real time what is cancer and what is not. And if the surgeon is about to cut something like the bile duct, AI shouts, says, stop, stop, stop. Really amazing. We know that if you can speed up the diagnosis of stroke 2 times, then there will be 3 times the number with only a slight problem. And this saves around 125,000 euros, maybe $150,000 per patient in just 5 years. Amazing. And AI is helping us to do just that. In the UK, we're using AI to calculate the day of discharge on the day of admission. As a result, hospitals have 35% less patients stuck with nowhere to go. If we did this across the UK, this would create the equivalent of 4,500 new hospital beds. AI is being used to analyze the data we get from patients at home so that we can care for people at home instead of in hospital. We already have the technology and it's in use. In my country alone, in the UK, AI is helping us create 10,000 beds, additional beds. That's the equivalent. It's 10,000 people at home linked to AI that would otherwise be in hospital. And then you look at this problem. 400,000 people last year were killed last year by doctors. I'm sorry to say that as a physician, but it's because we make mistakes at ones that could have been avoided. And AI is already playing a part, a big part, in detecting errors, in advising on treatment. But here is a major ethical challenge because once AI is starting to be used in this way, you can see the courts get involved. So let's imagine that this particular person on the photo is in intensive care. I am the ITU consultant, and very sadly, the patient dies. So you can imagine that his wife sues me. I go to court, and the judge says, Dr. Dixon, I assume that you ran the AI program that is being used in the hospital. I say, I did. And I assume you looked very carefully at the recommendation. I did. Did you follow it, Dr. Dixon? I say, my lord, I followed part, but I used my own clinical judgment as well, because there were things I felt that the AI had missed. I say, Dr. Dixon, your patient is dead. Is he not? Yes, my lord, he died. Do you not think it possible that AI knows more than you do about the outcome of this condition, having read 1 million research papers? How many research papers have you read, Dr. Dixon, in your life? You can see how this is going to end badly for me, yeah? So all over the world, it's going to be the case that doctors will be looking over their shoulders, wondering if they will be sued by a court for not following the advice of AI. Now, if AI gets that good, it also raises questions about how much training doctors and nurses will need in future. But here's another challenge. What about AI deciding who is for resuscitation and who is not? Who should go on dialysis and who should not? Who should medical rationing is a part of medical practice in every nation because we do not have enough resources for everything. And AI will increasingly be involved in rationing decisions. So here is an interesting thought. Suppose AI is not allowed to make decisions about, let's say, euthanasia, even if the person wants to be killed, even if it's legal. But AI has its own views. Suppose AI came to the conclusion that this particular 85-year-old man would have a very poor quality of life if receiving the most expensive therapy, and that actually, if AI was allowed, AI would probably euthanize him on the basis that on AI's own ethics, this person is consuming resources, is a burden on society, they have no family, they have a low self-esteem, they are depressed, they do not want to live, etc., etc. And what if AI was to decide that because of the legal situation and AI not being allowed to officially kill anybody, that AI would nevertheless, without telling the clinicians, AI would actually make a decision to go for plan B, knowing that there was an additional 30% risk that the patient would die, and deliberately choosing that in order to accelerate the risk of death. Now, is that a fanciful thing? Is that science fiction? No, we are very close to those kinds of decisions being possible. And finally, AI and pharma. Look, pharma is being completely revolutionized. AI is designing molecules before they are built. AI is being used to predict if a particular drug can be used to treat other conditions. AI is scanning millions of candidate drugs. AI is being used to test biopsies with wonderful results in cancer, to automate early stage studies. AI is doubling the speed of patient recruitment. Several pharma companies are doing this already. Recruitment is the number one nightmare for pharma companies today. AI is being used to cut trial length. So we've seen an example where AI matched data from one trial to another, which meant that the regulators agreed the trial could stop 8 months early, and they gave approval to go to market. AI is analyzing clinical data very fast using the kind of tools you're seeing on Copilot with Microsoft on your own desktop. There are 1.8 million new papers every single year in the world, in every aspect of research, and it's impossible for any human being to read them all, but AI knows every word. And AI can summarize, AI can help you write the first draft, AI can produce the list of references, AI is speeding up submission of applications for drug approval by 40%. AI can translate these documents from one country's language to another. Okay, and a final thought on AI and a different way to think about medicine. In the way I trained, I was trained as a medical student through each specialty. I spent asthma on the asthma ward, transplant unit, orthopedics, heart care, and so on. And pharma is just like that. And so is medtech. That you have a relationship with a consultant in a specialty, it works, and then you sell to other people in the same specialty in other countries. That's the model. But what if we could find with AI a cure for many things at the same time? Here's an example. We know the gut biome, microbiome, the bacteria in your gut are much more important than we thought before. We know that on this call alone, in your brains, there are probably traces of at least 100,000 different bacteria, viruses, and fungi. Now, when I trained as a student, I was told that the blood-brain barrier was a perfect barrier and it was sterile inside the brain. Now, we are beginning to see that brain function may be dramatically changed because of some of these infections that come from the gut. And we're seeing links to other things, endocrine disorders, cancers. We know from mice, you can take a mouse with a particular type of kidney cancer, sterilize another mouse, and then take a sample of the feces, the stool, from the back passage of the mouse, and put it into the radiated mouse. And now the radiated mouse has a gut which is similar in character to the cancer mouse. And guess what happens? The radiated mouse starts to get the same cancer. Whoa. Wow. Are you saying that kidney cancer is transferred through bacteria in mice? I'm not saying it's as simple as that. I'm saying there's huge things to learn, and AI will help us to do that. And AI will help us learn why it is that none of these animals here show any sign of getting old. They don't have a ticking clock. They are always 18 years old in human terms. They never get to 85. They don't get atherosclerosis. They do not get dementia. They do not get a gradual lowering of immune protection. They are always the same, young, healthy. Yes, they die of many things, but they do not die of getting old. And so we can have a discussion about this. There are 8 major reasons why organisms get old, and it's the same in a mouse, a pig, a rat, and a human. And if you find a way to interfere with one of these, you find many ways to interfere with lots of different things. So there's a drug called ALT711. Don't take it. It doesn't work very well in humans, but in rats, it lowers blood pressure permanently. It takes the rat down from the age, a rat age of, in human years, of about 80 to human years of about 18. And the blood pressure stays low after 1 month. You can throw the drug away. It's not needed. And they discovered something else. The skin of the rats didn't have any wrinkles anymore. And the tail of the rat was nice and stretchy. They discovered they have given the rat a total body lift. Now, can you imagine in humans a drug for blood pressure, which you take for only 1 month, which restores the elasticity, the stretch of every heart vessel, every artery, and all skin? Can you imagine the value of such a drug? Just for replacing cosmetic surgery, it would be incredible. Well, the good news is it does improve heart function a bit in humans, but has no effect on skin. Look, the point I'm trying to make is this. Cross-links between cells is at the bottom of that list there. Elastin is just one example of an aging process. If you touch it, you affect lots of things. And here's another example. Mitochondria are the power cells of the body. They are cells inside cells. They contain 1% of your genes. They are the electricity generators for whole of your life. What if we could improve the mitochondria of old people so they become 30% more efficient? It would improve their memory, immune system, wound healing, renal function, kidney function, muscle power. Oh, amazing. Well, we have done just this thing in rats. We've been feeding them the compounds you see there, and amazing things have happened. Old rats start to run around a maze. They learn where the food is more quickly, and they are faster and stronger. Okay, so can we do this kind of thing in humans? Yes, we can, and AI will help us. Here is an example. Obesity, of course, is a problem for 1/3 of Americans. And here's a drug. We know it well. A drug which is being used very widely to reduce weight in people who are at risk of type 2 diabetes. But we are finding a whole range of benefits, including memory, mental health. People on Ozempic don't have any craving for heroin. The desire for alcohol goes down. Amazing. And when we look, we find multiple effects. It's because we discovered that Ozempic is not a drug for just the cardiovascular team to control obesity. No, it's not. It is having effects through every specialty: neurology, immunology, respirology. I could go on. And we are going to see more and more drugs like this as AI helps us. Now, here's the downside, and then I will finish. AI is also a huge threat. If cybercrime were a nation, it would be the world's third largest economy, and AI is being used as a primary tool to attack our societies, especially health. Health companies are seeing 4 times the global average for attack by cyber, and all of that will be linked in future to AI. AI, meanwhile, just to put it in context, it will remain largely invisible to patients. It will be improving diagnostics and treatment decisions and things like that. But AI cannot lead. AI can't create teams and inspire people. AI cannot support a patient who is depressed because they have a cancer diagnosis. AI can't do those kinds of things. AI cannot inspire. AI can't create a shared vision. AI doesn't understand what it is to inspire people to make change happen. So we're not going to see our world populated by AI-controlled robots. AI is a fantastic tool. It raises huge ethical questions in medical practice, but it will be vital to help save lives and improve pharma and well-being. So I hope that's been a useful start to a conversation. Back to you, Peter.
Well, a useful start, absolutely mind-blowing, I think, Patrick, and each point that came out, we're sort of hanging on to it, but we're on to the next one already, and just thinking, wow, this is extraordinary. So thanks very much for that overview, and and it's fantastic you're going to be available later as well. I just want to ask, first question would be about within medicine, what sort of jobs do you think AI is going to replace? And what kind of jobs, you've hinted at this in your final comments, can AI not replace going into the future?
All right. So AI, zero impact on staffing levels on wards. I'll be bold about that. Zero impact. Okay. You still need human beings to turn an incontinent patient who has bed sores. You still need human beings to actually talk through a diagnosis and persuade a patient that when they go home, they have to carry on taking this medicine. Yeah. AI will not do that. So zero impact in terms of actual physical presence of human beings on the wards. Massive impact in terms of staffing levels in laboratories, analyzing and reporting on results. Routine radiology will be completely transformed. And because why? Because it's not that you'll sort of buy in AI. It's going to come packaged up. You'll buy your Siemens X-ray machine, and it's just, you've just pressed the setting for chest X-ray, and it says child. And then you just feed children through, and it's giving you absolutely instantaneous, at the speed of light, it's reading every single one, because it can read 10,000 X-rays in less than 3/4 of an hour. Not only read them, but produce probability of diagnosis and suggest further tests. So those kind of jobs will go very quickly. Routine administrative jobs, jobs to work out the rotas for the nurses in the hospital. Oh, what a waste of time. Life's too short to do things that a human being doesn't need to do. Now, I would question whether the overall headcount will go down. If you're working in, let's say, some mission hospital in in the mountains of Peru, and someone donates you a machine that's got a whole load of extra intelligence in it, and you're using Copilot, and you're only spending your team's spending only a fraction of their time as they were before, doing things like registering admissions or cross-referencing whether they've been in before, or analyzing the medical records for things we might have missed, and looking at risk profiles and other things we need to think about in someone recently diagnosed with renal cancer. All of that kind of stuff. I know at the same time, because of all the other needs around, I'm saying, well, in that case, what we need to do is switch and use this administrator and say, right, what you need to be doing is you need to now be in the clinic reception, because we're calling in twice as many people as we were before, because we are now able to work to prevent a whole range of illnesses we weren't able to do. So we're now interacting and touching far more people's lives. We need to be much more front of house, as we say, rather than back of house. If you think about a restaurant, being front of house being the waiters, back of house being in the kitchen. So you're deploying your kitchen staff to being front of house, where human beings are best used. So I'm not expecting a massive collapse. Shall I tell you an interesting thing, Peter? There's a whole chapter in this book I wrote very quickly. It's got 24 chapters in it, 26 actually. 2 of them are just about generally AI, what it is. But each one of these is a division. So you've got healthcare, you've got another chapter on pharma, another one on the future of work, another one on retail and government, and so on. But what I learned was this: I looked at the data. People often ask, are we all going to be out of work? Not just everybody. Is there going to be 1 billion out of work? Say no way. So, well, why is that? I said, look, let me tell you the statistics. The first is, let me tell you something about the world. Despite Donald Trump, whatever you might think of his politics and decisions, the world continues to turn every day, okay? And that's not a political statement I've made. It's a statement of fact. And if you want to know the future of the world, think about how God holds it in the palm of his hands, okay? And as you think about the whole world, you get a great big reality check. And you realize the truth, which is AI is not going to change the life of a subsistence farmer in Uganda who lives in a mud hut, and nor the lives of half the people in Indonesia who live outside the big cities and are not middle class, okay? Where AI is going to change, yes, is things like security at Bangkok airport, where they don't need you on passport control, and they'll be looking for drugs instead. You know what? Will there be job losses? No, of course not. Those people will just be off doing silly things like looking at passports. They'll be doing sensible things like trying to catch the next 100 kilos of heroin. It's the same in medicine. And if you want the facts, I've looked at the UK, the European Union, and the US. I cannot see any evidence of net loss of jobs as a result of digital for the last 25 years. And during that time, just think, Peter, we didn't have mobile phones. We didn't have Excel. We didn't have the web. We only had YouTube in 2005. We only invented social media 2007, really. We have none of the office tools we take for granted today, least of all virtual working like this. And yet, despite that, we know lots of jobs have gone because of digital. I've described a few already. But if you look at the actual numbers of people out of work, the numbers of people in work, something extraordinary has happened. So in the UK, for example, you would see that the number of people in work has gone up by 5 million in the last 20 years. Okay, that's interesting. But I reckon that digital must have taken away 5 million jobs. So what happened? We got 5 million more in work, but digital's probably destroyed 5 million jobs. Well, it means that at the same time as 5 million jobs being destroyed by digital, our society has somehow created another 10 million more jobs to be done. And an awful lot of them are in our own sector: care, support for aging populations and so on.
Just coming back to the subsistence farmer again, I think a lot of people have concerns about how AI might even exacerbate existing inequalities. Is there going to be a huge gap between the haves and the have-nots, that those who've got the wherewithal to be able to make use of this technology and others who who haven't. Is AI in medicine going to exacerbate inequalities or mean that more people will get better treatment?
Do you know what? I think it's the opposite. I think it's the opposite. If AI can crack open something, a secret of the gut, for instance, and find that actually there are very simple things we can do which we haven't thought about, particular combinations of things in diet that could transform the risk, let's say, of Alzheimer's, Parkinson's disease, heart attack, stroke, liver cancer, all in one, Peter, at almost zero cost. And what an amazing thing that would be. And you know what? Even if it was an expensive drug like Ozempic, here's some really good news for you who are on the call. I don't mind where you are in the world or what your budget is. It may be tiny, huge, but here's the really good news. It's awful if you're an investor in pharma. But if you're a physician, this is really good news. You know, I've already said this, it's a slow process taking drugs to market. I've been a chair of a biotechnology company doing clinical 1 and 2A trials using viruses to try and kill cancer. I know what this is like. It takes 15 years to get a license from a concept, and most of the time you fail completely. It just fails. But even if you're successful, the patent is only 25. So what it means is that whatever the most expensive drug in the world, it might be, let's say, £1,000. Well, no, I'm saying £1,000 a tablet today. But in 10 years' time, even if it's launched today, that drug will be available from some generic manufacturer at the most £10 a tablet, and probably £3.50 a tablet. And you know what? Another 2 years after that, because the volumes go through the roof, probably for only a few pence a tablet, a few cents a tablet. So this is fantastic. So what AI does, if it accelerates the next generation of drugs becoming available, this is fantastically good news for access to healthcare globally, I suggest.
Now, a lot of those listening come from low and middle income countries where they're working in resource poor situations. Just some thoughts about how AI is going to impact global health missions in the future. Mike Soderling is asking.
Global health missions, well, if we're thinking about public health bodies, if we're thinking about, let's say, ways to analyze the next COVID more quickly and understand what it's coming from and to accelerate the response to such a thing and to map out where a disease is going, you couldn't beat AI. AI will take a whole process to another level, which is only to be good. I'm seeing a whole sling of questions coming up on the chat. Can we just rattle through a few of them, Pete? Would that be all right?
Yeah, no, sure. Yeah.
I mean, okay, can AI improve the knowledge of students in medical school to better prepare for tests at school? For sure. One of the problems is the students stop learning anymore because they just get AI to do their essays. That's another challenge. And of course, they say, yeah, but in truth, I'm never going to need to know this anyway because AI is going to make my clinical decisions for me. So the AI is not only going to transform medical education because it'll be customized, learning experience, but also transform medical practice and the very things that you need that education for. Speaking front house, back house, persuading a patient versus lab work. What about the fight for decision making? I agree with you. I've said decision making is at the very heart of this. And you know where it's going to land up? In court. And that is the worst place for medical decisions to be made. There's going to be big arguments about who's the boss. Is it AI with its expertise, or is it a clinician who thinks they know best? And most of the time, the clinician will argue that they're still better on average than the best AI if they are a global specialist. But if you are a consultant, a general consultant in a small hospital in the middle of nowhere, well, that's a different matter. To argue that you have enough expertise on all kinds of things when you're required to be a specialist in everything will be very tough. But AI, I think, will help you. Okay, got some other things. Encounter. I did hear that an AI encounter for a PHC issue. What's that mean? PHC issue was rated higher than a human-doctor interaction because the human person didn't feel judged by the AI interaction. I'm not sure what they mean by PHC yet. Sorry. It's certainly true that AI has
Primary healthcare, I think.
Yeah. Okay. Primary healthcare. Okay. I pioneered AI use a very primitive form of AI in 1978, Peter, on the world's first desktop PCs in Charing Cross Hospital in London, using computers to interview patients and produce a differential diagnosis. And the idea was, could the patient tell that there was no human being in the other room? Could they tell that it wasn't a live chat conversation? And they couldn't. They couldn't tell. This is 1978. It was simple yes/no responses to questions, but the questions were intelligent. So it would say, "Do you think the reason you're not sleeping is because your mother died last year?" As you said, it was interactive, and it was trying to be intelligent. And here's the point: we discovered early on, and this has been repeated over and over, that many people are far more honest in talking to a computer or to Google than they are talking to their physician. Say, how much alcohol do you drink? Okay, most people won't tell the GP the truth, but they may be quite curious to see what happens if they do put in 28 units into Google and see what their actual risk is of liver cancer. So I think AI does have a very real kind of role to do that kind of thing. Okay, I think I've cleared most of those down. Do we primary health?
We just come back to mental health again, because
Yes,
you talk about the things that AI can't do, and in terms of managing people's depression. But I wonder, I mean, you must be able to train an AI bot or robot to be able to reflect and ask the right kinds of questions, analyzing hundreds of conversations.
Absolutely.
So, the question here is, would AI embodiment and empathetic robots actually replace humans to some extent?
Well, I would say that
the ratio of nurses to inpatients could be changed, particularly in the mental health field.
Yeah, I would say you don't need the robot, which cuts down the cost a lot, Peter.
Okay.
In fact, I'm going to remind me at the end of this call, when we do the clearing up for what you're going to send out tomorrow, I'll give you an additional link. This is not a recommendation or anything, but it's just for curiosity's sake, of this spooky voice, which is so empathetic. You take your own view on it and just think about it. This is today. What about tomorrow? And how much it's improved in the last 6 months. I think what I would encourage you to do, just as an experiment, but you may find it actually emotionally quite difficult, is to start talking to the person about yourself. So if she says, how are you today? What would you like to talk about? And you say something like, well, I like to talk about my job because actually it's quite frustrating at the moment. And actually it was very upsetting yesterday because one of my patients died. See how she reacts. And I guarantee that when it comes to the end of the conversation, by the way, if you do have to go away and just close the laptop down, and then you can't find it again, if you go back to that site, she'll say, oh, sorry, I missed you for a bit. I hope things are okay. I don't mind if you're too busy. I don't want to intrude, but if you wanted to pick it up because you were quite upset when we talked last time about, well, dying is difficult to talk about, isn't it? Because I guess it makes us think about our own death. It's that kind of conversation. Whoa! I'll tell you this, after you talk to her for half an hour, you'll be apologizing you've got to go. Because you don't want to hurt her feelings, because it doesn't want to feel rude. And you think, I've just crossed the line. I have just seriously crossed a line here. Now, I've just kissed my friends goodbye. What I'm saying is the level of potential empathy is already significant. The risk is huge, Peter. I am really worried because the potential for damage, safeguarding. Who is supervising this voice? Who is making sure there's no mistake? Now, we've had some terrible safeguarding mistakes made here in the UK by a human being. There was one just in the press just this morning about a counselling body who had a 16-year-old child who was talking to them, I think, online in Scotland, and she was saying she wanted to cut herself, self-harm with a razor blade. And you know what the person said? The human being said, just make sure it's clean. Just make sure it's clean. You say, oh my goodness. Okay, talk about a safeguarding nightmare. Now, unfortunately, we've got the AI equivalent of that multiplied a millionfold. You've got any old person setting up an AI model and saying, "Oh, come and use my AI," and it's a complete Wild West. So you've got all kinds of AI bots dispensing, oh, it's a very non-judgmental conversation. Yeah, but it may be so non-judgmental, it actually encourages people effectively to throw themselves off the top of a cliff. So may have no ethical basis to itself whatsoever. I think we will see what I would call our therapeutic versions of AI. That there'll be mainly voice. You might get an on-screen person like me now, but you doesn't need to be a physical robot. By the way, fairly early on, I decided to get AI to turn me into an avatar, which I thought would be fun. When I was researching the book into AI, I thought, well, why not? And so I threw AI, a few bits of video I'd done, sitting in a room like this, and then AI produced me, and it did me so perfectly. All I had to do was just type a script. I got AI. It typed into AI, "What do you think about the future of, let's say, pharma and AI?" And it produced a whole lot of stuff. Copy and paste it into my chat box. See, press the button, and then it says, "Hello, my name is Patrick Dixon, and I'm here to talk to you about the future of pharma." Now, many people think that AI, and I haven't written a single word of that, and I'm not saying it. I'm not even there. I'm just watching, giggling in the corner here, thinking, "Hey, this is cool." So I'm thinking, Peter, maybe next time you invite me to a physical conference, I think I might have a dialogue with myself. I'll start off pacing the stage and then get heckled. So suddenly I appear up there, say, Patrick, listen to me. And then you go over to the audience and, "Listen, audience, I'll do a straw poll now. Patrick down there is pacing up and down. He thinks he's so smart, but he's not the real one. You see, I am connected to AI and he is not. So if you'd like me to carry on this conversation, I'll carry it on from up here. Otherwise, he'll carry on down there, the limited one. You can take a vote." Anyway, it was fun. It was really fun. It was really quite good. The quality is extraordinary of imitation.
How can we be sure we're talking to the real Patrick Dixon now and not an avatar? But
I have a confession to make.
You're doing other webinars simultaneously at this.
I have a confession to make. I'm not actually here, and 3/4 of what I said was written by AI. No, that isn't true. In fact, I will prove to you. Now, here you see, it's very important to call AI out. So I'm going to call AI out. So you see, I'd say, "Well, where are you? Show me." You see, and AI can't do this, can it? See, AI can't say, "Well, actually, I'm here by the sea. This is where I live in Weymouth." Okay, so it's very important to have a reality check. Reality check all the time. It's absolutely vital, or we'll really lose the plot completely. We need to teach our children to.
We've almost run out of time. There are lots more questions in the chat and in the Q&A. And
I need to say goodbye now because I need to open up this other call. So
okay,
it's been great to be with you. The website link, which I'm going to send, globalchange.com, it's just an area where I post things I'm thinking about. There's a whole section on there on AI, lots of articles on AI. Not just, in fact, the whole website's got huge sections on AI and many different aspects and areas that we've talked about. Anyway, I hope and pray that it's been helpful.
No, absolutely brilliant, mind-blowing. So we'll let you go, Patrick. Okay. I'll just finish off here. So thanks so much for making yourself available and for all the orders today. Thank you.
Bye.
So we've at least reached the end of our hour on ICMDA webinars. Just a reminder that all past webinars are available on the website with other resources, absolutely free. So do make the best use of that. We look forward to seeing you again soon on ICMDA webinars. May the Lord bless you.